So I want to welcome you all here to this little meeting. We've had multiple questions about the health directive that our public health officer issued on Friday, and that's why we're here today, to answer questions about that. I just want to emphasize this decision was made in the interest of protecting public health, and not to steal any thunder from my public health officer, but he has constantly reminded us that when all of this started and schools were shut in the county and all schools closed down, there were 4 cases a day in the county and an average of 20 cases a day in the state. Today, and for the last week or so, we've had 20 times 4 cases a day as the norm. So we're in a more difficult situation than we were when the decision was made to close schools down in the first place. And I think it's important for the public to understand that. It's not an easy decision. It's not something we made lightly. We know how stressful this is. It's stressful for everybody, whether you're in public schools or private schools. The issue with, the learning and with how do people go to work, these are real problems for everybody in Montgomery County and everybody in the state of Maryland. We are well aware of that. I'm going to turn this over to Dr. Gayles now to explain the basis of why we made this decision. Dr. Gayles?
Good afternoon, everyone, and thank you for the opportunity to be with you this afternoon. First, before I get into my remarks, I want to highlight the work of all of the individuals who have been working on the public health response and emergency response from the county to get us where we are, and working motivated by public health practices and data to drive the safety of our community across the age spectrum. I think we all agree and have said numerous times before that when we look at the options for educating children, that in-person schooling is the preferred method. But I don't think anyone denies that. But what is different is we're operating in a pandemic situation where we are fighting a virus that is hitting our communities hard. And where we continue to see increases in cases across the country, across the state, and across the region, suggesting that we do not have control over the virus to date. As a result, as the county executive mentioned, back in March, when we made the decision, or the decision was made at the state level to close schools, where public schools as well as private schools closed, we were averaging 4 cases a day in Montgomery County, and the state had a daily average of around 20 cases per day. At the same time, the cases were disproportionately impacting residents who were over the age of 60. As time has moved forward, we have had increases in cases and currently are sitting at an average of approximately 80 cases a day here in Montgomery County. And the state is averaging in the last week somewhere between 800 to 1,000 cases per day, for a total of over 90,000 COVID cases throughout the pandemic. And 16% of those new cases are ages 0 to 19, which is different from where we started when schools were closed in the very beginning. Now, Dr. Birx, who heads the President's Task Force, COVID-19 Task Force, stated yesterday on a series of newscasts that in order for us to reopen schools safely, we need to have lower community transmission and daily caseloads. And in the absence of that, remote learning is preferred until we have control over the virus. We're not there as a jurisdiction, and we're not there as a state and as a region in terms of having that demonstrated lower community transmission and lower viral load within our communities. And that is the impetus behind putting in an order to have schools closed until we see much more significant progression in terms of lower community transmission and lower viral load within our communities. Now, based upon that, we had received some feedback that private schools were considering reopening and had not had any conversations or discussion with the schools related to their particular plans. When we were made aware that schools were planning to reopen in the near future, we pulled together a town hall where we allowed for the schools to send in their questions, concerns, and comments, and myself and Dr. Earl Stoddard participated in that town hall and answered a lot of those questions. Now, from that conversation, it was very clear that based upon the questions that were submitted, that there were significant gaps in terms of understanding COVID understanding the principles of transmission, understanding very clearly the types of things that should be implemented to keep students safe, and the types of environment and the types of practices that have been recommended as best practices to implement as transmission mitigation strategies. In that conversation, recognizing that gap in knowledge, we said very clearly that we would work with schools to, whether it's through webinars or outreach and looking at plans, we made it very clear that we would work with schools to make sure that they had the guidance in place to be able to move forward to operate successfully when we were in a space and a place where we had demonstrated lower community transmission and lower daily case loads. Now, after we had that conversation, we received feedback from a number of places thanking us for that, but we also received feedback from some schools, or it was communicated that in spite of those recommendations and in spite of that conversation, that some were planning to move forward as early as this week without considering in any of those conversations or guidelines that we offered and put forward. And that was the concern, and that was the impetus behind putting the directive in place on Friday. We acted quickly when we received that information because we wanted to make sure that those provisions were in place when Monday arrived and in the event that schools were planning to reopen. Now, I want to take a step back and also, again, emphasize that all of the different guidelines that have been put out from CDC, American Academy of Pediatrics, and so forth, are built upon the premise that there is lower community transmission and lower daily caseloads in communities in order for schools to reopen. And again, based upon the data that you look at the state totals, you look at the national capital region, you look at the Baltimore metropolitan area, these are all places where kids are pulled from who attend our private schools. And in these jurisdictions, we're seeing increases in cases, which again confirms that we are not seeing lower community transmission, and we have not put a firm hold on the impact of the virus and virus spread in our communities in order to move forward. Now, there are lots of other arguments that have been put forward in terms of how to reopen. There have been guidelines built again on the premise of lower community transmission and daily caseloads, and we continue to study those other jurisdictions. While we look at our numbers here in Montgomery County, we also know that we have to keep an eye out on the region and other areas where kids travel from. These guidelines also have been built upon the premise and the belief that kids transmit the virus less and experience less severe symptoms. Well, as a reminder, schools are not just places where kids go. They're teachers, they're administrative staff, there are other staff who are involved who are maybe at risk for more severe complications. For example, I think a school system in Gwinnett County in Atlanta attempted to open up last week with a teacher in service. And as a result of that, they had several cases, individuals who were positive for COVID-19, and over several hundred teachers and staff now are quarantined for possible exposure in that attempt. We have recent evidence has shown out of Chicago and a number of other places that have also shown that kids as young as preschool age actually potentially carry higher viral loads and copies of the virus in their nasopharynx, which allows for them to transmit the virus as efficiently as adults and older children. Now, we've unfortunately also seen over the last week numerous examples of schools who have been reopening in other areas, and even within the first several days of the schools reopening, they've had to shut down due to cases happening in children and staff. That includes examples in Indiana, Texas, Mississippi, among other places. Another point that I want to highlight is that all of the guidelines that have been put into place are recommended. They're very well thought out. And so I think there's a little bit of a misunderstanding in terms of the reasons and rationale behind why we are asking schools to pause for in-person learning. So yes, guidelines are important. CDC's put out guidelines, the state's gonna put out some guidelines. There's all these conversations around what are the best practices to do this safely. Unfortunately, all of these practices are supposition. They're very thought out, don't get me wrong, and in fact, they're going to be crucial to moving us forward when we do open the doors back up for in-person instruction. but they again are built upon the premise of lower community transmission and lower daily caseloads. In fact, when you look at the CDC definitions for low prevalence, that translates to, based upon the math that we looked at, 8 cases a day here in Montgomery County. And when you talk about moderate transmission, that translates to 38 cases a day in Montgomery County. As I stated in the opening part of the statement, we are sitting at 70 to 80 cases a day. So we've not achieved that goal of having lower or moderate transmission, which would be a space where it would be considered to be safe for schools to reopen. And the unfortunate thing is all of the guidelines that have been put forward are built upon, again, hypothetical models, because when we saw very low caseloads, again, going back to in March where schools were closed, kids have been out of school since then. And we don't have a full accurate body of data to fully know what will happen when we open up schools and what will be the impact of those parameters and how effective those parameters will be at keeping kids and staff safe and mitigating transmission. The last thing I want to bring up and highlight as part of our rationale and decision-making process is that some folks say, well, you know, other countries have been able to do this. Well, it's not really apples to apples in terms of comparison due to a number of factors, but when we do look at some of those other countries, for example, Denmark and Germany, their caseloads were significantly lower. For example, Germany, the comparison, I think at the time they reopened schools, they were seeing 0.8 cases per 100,000 residents, which would translate, when you translate that to Montgomery County, that comes to 9 cases a day, again, which is far less than where we're averaging right now at 80 cases a day. And when we look at Denmark, their case count was actually 3.3 cases per 100,000 residents, which translates to approximately 35 residents for us here in Montgomery County on a daily basis. So in summary, the reason why we made the decision to move forward was influenced by a couple of variables. The first one being having established lower community transmission and lower daily caseload, which we have not achieved here in Montgomery County, although we've made significant strides, and we've not achieved across the National Capital Region, as well as other areas where we know our students come from. And that is the impetus behind saying, let's pause, in addition to working through and developing contingency plans to keep kids safe in schools. But the biggest premise is we have not achieved, in the words of Dr. Burks, we've not achieved lower community transmission and spread and lower daily caseload. We continue to work to achieve that goal, and we're hopeful that we'll not only achieve that in Montgomery County, but across the state and region as well, so that we can, as part of the continued discussion, working with schools to make sure they have plans in place to keep kids safe, to make sure that when we are at a point where it is safe, we've achieved that lower community transmission, that those plans will be effective at keeping kids safe when we move forward. So that's our thought process. That's what went into our decision. And we're confident that we will continue to move forward using the data and the science to drive those conversations to keep our kids safe and keep the residents of Montgomery County safe as well. Thank you.
Thanks, Dr. Gayles and County Executive. We have a question for both the County Executive and Dr. Gayles from Chris Gordon at Channel 4.
Okay, thank you very much for having this availability today to, clearly explain the position, the thinking behind this. What is your reaction to Governor Hogan's statement and tweet saying he strongly disagrees with the decision in Montgomery County to close private schools and that it should be up to parents and not politicians?
Well, I will answer this and say this, Chris, with all due respect to the governor, for me to answer that question, that would make a political statement, and I'm not a politician, so therefore I won't comment any further on it. But I'd be happy to discuss any of the further merits of our decision based upon the science and data that we use to get to that point.
So I guess I'm the politician, right? Look, I mean, the governor, in first place, referenced this as a political, and shouldn't be a political decision. It wasn't a political decision. It was a health department decision. I have, throughout this, relied on the advice of our chief health officer. Because when you're dealing with the pandemic, I think the best model to follow is dealing with the people who are health experts, not people who are political. So I don't look at polls. I don't look at anything regarding what's the right thing to do. I talk to people who are trying to bring this pandemic under control so our residents can at some point resume a more normal life. So that's where this decision comes out of for me. And I'll just remind you again of what Dr. Gayles said in the very beginning. When the state shut everything down, they shut it down at a far lower level than we're at today. So if it was prudent and wise to shut it down when Montgomery County was having 4 cases a day, you would think it would be prudent and wise when we're having 80 cases a day. For a brief moment, we had cases down in the 50 to 60 range. Mm-hmm. And since then, since the state reopened and since Ocean City did the things that they've done, we've seen our cases creep up probably 20 to 30 cases a day. We're plateaued again, but we really need to see those numbers going down. And that's what we're going to continue to work on. We will make decisions that help us drive those numbers down. And with those numbers down, we will continue to reopen, as we've already done, to make it more possible for people to do things. None of us likes closing. I get no pleasure out of closing things. I'm a former school teacher. Trust me, I know how hard it must be to try to do this remotely when this is a job that really requires hands-on. But more than the job requiring hands-on, these kids deserve to be safe, the teachers deserve to be safe, and the staff deserves to be safe. And I'm not going to pick the optimal learning environment over a suboptimal health environment.
Thanks. Caitlin Peets from Bethesda Beat has a question for Dr. Gayles.
Hi, good afternoon. Thank you for your time. This actually wasn't the question that I was going to ask, but the governor just put out that he has issued an amended emergency order to ensure that school systems, including private schools, have the authority to make reopening decisions, citing the Maryland Public Schools Recovery of Education Plan, which stresses flexibility. Do you guys have any initial thoughts on that?
Haven't seen it, haven't read it, haven't heard about it until you mentioned it.
Yeah, it just was posted 2 minutes ago, so I could understand that.
You're ahead of me.
What I would say, I would continue to emphasize what I stated before. It doesn't matter if we see the governor's tweet. It doesn't matter if we see the statement, because it doesn't change the fact that in the state of Maryland, the cases are increasing significantly. As County Executive mentioned, there was a time several weeks ago where we had gotten to 40 to 50 cases a day, and as a state, we were seeing 300 cases a day. That's not the reality. And you can't dismiss that. Over the weekend, there was a day where we had over 1,200 cases. This morning, there were almost 900. Yesterday, they were 900. And the reality is, reopening is premised and built upon the premise of having lower community transmission and lower daily caseloads. That is what we should be talking about. That is what should be driving the decision. If we want to talk about taking and divorcing politics from this, we would focus on the health features and the health factors. Dr. Birx, again, who is the head of the President's Task Force, has said very clearly that in order for schools to reopen safely, those principles must be demonstrated. It's very clear, anyone looking at the epidemiologic data for the state of Maryland and the National Capital Region would come to the same conclusion that we have not achieved lower community transmission. In fact, the numbers are increasing. And that is what should be driving the conversation. That is what should, quite frankly, be the conversation. And we should be talking about the new studies that suggest that kids may be at increased risk. That should be the discourse. Unfortunately, that is being sidetracked, but we will continue to focus and use the medical science and the clinical data to drive the decisions that we put forward to keep the residents of this county safe.
Thanks, Caitlin. We're going to go next to Tom Fitzgerald from Fox 5 and then Kate Ryan.
Thanks for doing the call today. And yeah, we were all just digesting this release that just came from the governor. So I'll give a question to Dr. Gayles and a question to the county executive. But Dr. Gayles first, I'm going through this release from the governor. I know you have not seen this, but one of the things he says in this is that as long as schools develop safe and detailed plans that follow CDC and state guidelines, they should be empowered to do what's best for their community. So I guess the question is this, Dr. Gayles: if the schools come up with a plan that follows CDC guidelines, why wouldn't you let them open?
I've been very clear in my comments. You're missing the point. What we're clear about is that, and this is the unfortunate reality, you're missing the point. It's been clear and demonstrated that in order for contingency plans, whether you're following the CDC guidelines or other kind of things, in order for them to be successful, you must have lower community transmission. You must have lower daily caseloads. We've not achieved that. And when you look at examples across international examples for those who have been able to do it successfully, the burden of the virus has been significantly lower in those places. You can look across the country in the last week where we've seen other jurisdictions who have reopened and they've had to close down because guess what? They have cases and their viral load isn't low and their community transmission hasn't been lowered. If we divorce politics from behind this and we look at the health, that's what the experts have said. When the CDC plans and the local plans, they say, what does the jurisdiction look like? What do the transmission rates look like? What does the viral load look like? And so that's what should be driving this conversation. And it's interesting that, throughout the pandemic, we have been asked as local health departments to make the decisions that we need to make to keep our residents safe. And the governor has time and time again said that he would defer to the local health departments to make those decisions. That's what we're doing, and that's what we have been doing, and that's what we've been attempting to do. So the question would be is what's different about this situation, and where we have clear evidence from national experts and international experts who demonstrate that lower transmission and lower community transmission and viral load are the factors that will influence the ability to successfully reopen.
I'll just add, I just want to add to that. It wasn't that long ago when Montgomery County and Prince George's County comprised over half the cases in the state. And that's not true today. And there was a moment when there was a push for reopenings, and some counties went farther than we did. Montgomery County probably maintained the more restrictive approach to reopening. I will point out that if you look at the charts now on where the cases are coming from, they're not coming primarily from here anymore. I think, and Dr. Gayles can correct me, our number of cases out of the state's number of cases today, we're about 10%. A far cry from where they were before. And so when I get these emails or these questions about things are getting better and look where you are, it's like, how do you think we got here? We just didn't keep doing what the governor allowed or the maximum allowed. We made a conscious decision that we didn't think that was safe because we thought the viral loads in the community were too high. We chose a more cautious path. And so when people tell us how well we're doing, I want to say, thank you very much. How do you think this happened? It happened because we charted the path to put people's safety first. That's all we're doing here.
Can I ask you my question,
yeah.
County Executive?
Go ahead.
We were with the governor in a news conference just last week, and he had really congratulatory words about Montgomery County. And I know the two of you have not always seemed eye to eye through all of this, but this seems a significant deviation from last week's compliments. So what do you see going on here? Why do you think the governor has singled out Montgomery County here?
Well, I think because we were the first county to step forward and say we're not ready to open, private schools. I don't understand how, frankly, from my point of view, I don't understand how the governor separates private schools from public schools. The public schools, there wasn't a question for public schools about what's your plan. If you looked at the plans the public schools had, they had good plans. There's an intersection, though, between a plan and the conditions in which you're trying to implement the plan. And that is what Dr. Gayles has been trying to get at. You can have the best plan in the world. If your caseloads are too high, that plan will not work. And the governor was happy to have us do things a little bit differently and get better results, because we've tried to take into account what is the load and what's the effect of opening up. And I wish he would just let us continue to be careful. Like I said, none of us likes this, but we have reason to believe, and the data to support, that a cautious approach is the right approach. And maybe he's under a different set of political pressures, but I know that a plan in itself is not adequate given the way the virus acts in the community. So we have a disagreement here. We've had disagreements before. I'm glad he liked where we got, even though we got here by doing things differently than we suggested. Hopefully we'll be able to stay where we are and improve because we do things a little bit different than he suggested.
Kate Ryan from WTOP has a question for both County Executive and Dr. Gayles. Are you there, Kate?
There we go, yes. Okay, I did want to follow up on Caitlin's initial question here. And again, knowing that you haven't seen this order, if in fact the governor has made this order, I think parents are feeling a bit like a ping pong ball. Who has the authority, and are my schools, bottom line, if I'm a parent or independent school parent, do my kids go or not? What can you give us the latest on that? And then a separate question, but connected, is this in any way related to the October 1st date? That's when public schools have to say what their enrollments are, and that's a part of the budgeting process at the state level. Is this somehow related to budgeting for public schools versus private schools?
Absolutely not. This has nothing to do with this at all. We have not been approached by the school system. No one from the school system has talked to me. No one from the school unions have talked to me. Nobody has talked to me about this. This is strictly about giving us time to see if we can get the numbers to a point that we have a climate where the best plans can also be effective. That's all this is. This whole rumor about this just stuns me, because you could look at any email I've gotten and it's never come up.
Gotcha. In terms of, again, legal challenge to this or ultimate authority, because I know that parents are going to be asking, what happens? How do I plan? Who do I listen to?
Well, from our perspective, we've not had a chance to read through the governor's most recent information. I think it would be prudent for us to have an opportunity to read through it, to digest it, and be able to respond to that more fully after we've had a chance to actually see what details are included.
I'm going to take two more questions. Donna St. George from the Post, and then Deirdre from MC Media. Donna, do you want to go ahead?
Hi, it's Donna St. George with the Washington Post. I wonder if you, Dr. Gayles, could elaborate a little bit more about the kind of legal authority upon which your decision was based. Is there part of COMAR or part of state law that gives you the authority to make this sort of decision? That question has come up from parents a number of times. And if I could ask, sort of adding to Kate's question, why October 1st? Why was that selected as a date?
So let me be clear. From our perspective, quite frankly, I don't know anything about budgets, when budgets are due or things like that, because that's not in the public health realm. I was tasked as a health officer to oversee the public health response for this county and to keep people safe. It is very frustrating. And I'm just going to speak very candidly right now, and I always do anyway. Public health officials have been charged and tasked with leading the health response across the country for the last 5 to 6 months. I've worked 155 days in a row without a break. Many of our staff have worked over 150 days in a row without a break. Our main motivation is to keep the residents of this county safe and to do everything we can in our power from our expertise, looking, spending time, reaching out to others across the region, across the country, to figure out best practices to keep our residents safe. I can tell you 110%, there's been no formulation or conversation about the budget in terms of school census. I didn't even know that existed until you brought that up. We selected October 1st because we were trying to get an approximation based upon the first 6 weeks or the first quarter within which schools operate, recognizing they open sometime in mid-August to early September. And so that's why it was a nice clean date to be chosen, is to say this gives us additionally approximately 60 days, 6 to 8 weeks of an opportunity for us as a local jurisdiction as well as a state to drive the numbers down to moderate transmission or low transmission, to get to a point where we can feel comfortable that if kids are going to go back to school in some settings, that the contingency plans that they have in place are safe to be executed given lower community transmission and lower daily caseloads. So from our perspective, that's why October 1st was decided. We looked at this, and again, I'm not a politician, I'm not an elected official, and I'm also not an attorney. So I would defer to our county attorney, who could comment more in terms of the legal provisions based upon COMAR and the regulations set forward. What I can say is that part of the emergency declaration at the governor's level, empowering the Secretary of Health to make decisions, as part of the COMAR regulations, local health department commissioners are granted the powers and authorities as extensions of the Secretary of Health to be able to execute practices, policies, and regulations that are necessary to keep their residents safe and mitigate disease transmission in a time of a pandemic. And so consistent with that declaration, and consistent when we implemented face covering mandates back in the first go around before the state did, back when we implemented face covering mandates in June, as well as the same powers and provisions that we've used to guide our reopening guidelines and statutes. The authority that was used to drive this directive is consistent with those same authorities that were exercised in previous situations, again in situations where we as a local jurisdiction took action to keep our residents safe.
Deirdre Byrne from IMC Media, last question, and then we're going to have to end this and see you on Wednesday. Deirdre?
Hi, thank you for taking my question. There are several Archdiocese of Washington private elementary schools, K-8 schools in the county, and usually for something like a snow day, they would follow what MCPS is doing in terms of closures. They released a statement yesterday, the Archdiocese of Washington, saying that after the news that private schools are to remain closed until at least October 1st, that they're reviewing both the county's directive and Governor Hogan's statements regarding the opening of schools. I guess my question is, have you heard anything from the Archdiocese of Washington, or are you expecting any sort of pushback or lawsuit there?
I've not personally heard from the Archdiocese of Washington. I'm sure they may have communicated with other individuals within the county government apparatus and operation, but I have personally not received any outreach or comments directly from them. And, you know, we do get lots of emails. I may have missed something, but between, as best as I can recall, I have not received any communication from them directly.
The only time, the only time they've reached out to us that I'm aware of is a day before our plan session last week, asking us to review their plan at that point. We said, let's talk after our plan review, and after that, we did not hear again from them.
Thank you.
Thanks very much for joining us, everybody. Members of the media, you know, we have our regular Wednesday media briefing this Wednesday at 12:30, and we'll see you then, if not before. Thanks again, and we'll see you later.